then I've decided to go live and come in front of you guys, introduce myself, and what I see is as a consumer's doctor, my goal, my passion has always been healthcare coverage for all Americans, irrespective class or you know healthcare status or physical or economical status. Through a non-profit organizations, I'm trying to see if I can, as a consumer's doctor, I could make a difference. Folks, for the first time, I'm introducing my app, so-called. I want to make this into an app, but right now I'm in the preliminary stages. I'll I'll make it short, folks. This, when you go to consumersdoctor.com or mobilehealthinsuranceplan.com, mobilehealthcoverage.com, you have several domains linked to this so-called landing page. I made it very simple and very short. So that way you guys will know what exactly my focus has been. Through a mobile phone, you should be able to get healthcare coverage. You should be able to get high deductible health plan, which qualifies you for a health savings accounts. My focus is towards the employers, all employers out there. I'm a uh, so-called small business guy with 25 employees, but I would like to see all the smaller employer groups look into this health insurance. I know there are a lot of hurdles to go through, folks, but we are getting there. I think the technology is on your side, technology on consumer side. I believe one of these days technology will play a big role rather than government, so-called government intervention. I believe with mandatory minimum wage and other things coming up, I believe there is a role for every person to get their healthcare coverage through their mobile app. What I've done here is, if you can look at it, it is a real version of a mobile app. I used it at the top of the landing page. Mobile health insurance plan. What it includes is health insurance plan, which is a deductible along with health savings. This is my goal for you to have this healthcare access, which is under your control. I want consumers to be driving these healthcare premiums down, not up. Once the consumers are empowered, folks, I believe the premiums will start falling. This all started when I received a bill for a 23-hour stay in the hospital. I got a bill for 227,000. This is where the whole my life has changed, and I've made it as a goal towards lowering the healthcare costs and lowering the healthcare premium. I'll continue to do it as long as I'm there. This is my ultimate goal, is to see the healthcare premiums and healthcare cost, especially for the people who are impaired, especially for those people who are physically impaired, economically impaired, they can't afford it. This is where, even with the mandatory minimum wage, there should be a separate payment category, like what Medicare covering the senior folks, even among in the mandatory minimum wage, they should. Even among the senior citizens folks, I would like the senior citizens to be empowered, not the middlemen, not the manage care of. I would like that $1,200 to $1,300 what the Department of Health and Human Services pays to this mid-level agency. You can see the advertisements, folks, for the Medicare Advantage. The time has come. We should invest in the citizens of Americans, especially the senior folks, and even for the young folks who are self-employed, who are on the mandatory minimum wage. Whatever you see down the line, you should include a certain payment for the health care. I really believe that there should be a certain payment. The payments can be lowered as long as you give directly to the consumers, because consumers demand, once you empower them, consumer demands, like what we have, Amazon, it's all consumer driven. Even Google, Facebook, you name it, Twitter, it's all consumer driven technologies, folks. Healthcare is no different. I don't see any difference in healthcare, but ultimately, once the premiums are lowered, I'm sure the billing system needs to go away. Billing system, it has to be paid as you receive the care. It is there, folks. We just have to explore the avenues how to pay for the care. Yes. What I'm trying to do is, if we get a certain amount of money put aside for the so-called deductible health insurance, for a youngster who has no medical illness, the payment should not be more than $50 a month. Maybe it should be a lot less than that. Anywhere 30 to $50 a month for health insurance. If they don't have any medical issues, and as they age, the premiums can go higher basing on the age. And once they get this deductible health plan, they can put money aside, a portion of their own funds. I'm talking about $10 a day, $300 a month, $3,600 a year for an individual. I'm talking $20 a day for a family, $600 a month, $7,200 a year. It's not difficult, folks. It is not difficult. I think we are there with the minimum wage and the pay scale. We should be able to put money aside into the health savings accounts. Health savings accounts is nothing other than you having a Apple Pay card, debit card, whatever you may call it, health card, with all your medical information stored on your health card. I believe the time has come for the health information needs to be on the card with a payment. The technology is there, folks, but there are a lot of hurdles to rules and regulations and bureaucracy and whatnot. But I believe time has come for the consumers to take charge. So let me go through what my the so-called landing page does. If you go to this site and this mobile health insurance, you have each button. You have a button for each. So if you want a family care savings, you can go onto this button. I need to provide you a right link, but right now it goes to the health savings accounts. And as for the care for mom and dad, it goes to the senior facilities like independent living, continuum of retirement communities, and you can shop for the healthcare. If you go to the shop for the healthcare, you should have ideal link for shopping the healthcare gadgets, automation. It is there, folks. It is there. And when you go to the savings, you can accumulate the savings year after year, year after year. And For a family, you're talking about $7,200 a year in 10 years. It is linked to the brokerage account where it grows to almost 100,000. I'm not kidding, man. I will help you. As I'm not looking for any gains, I will do as a volunteer for you guys. It will be linked to a brokerage account, and it will be tied to an index funds. So the risk is little, but it can grow as long as you contribute every year. Yes, and you have a health and fitness button, and you'll also have ultimate link to all the network providers, physicians, labs, hospitals. It is too early for me to link all those sites, but ultimately you will have a link created, and you can go to the social media. You can interact on the social media about your insurance premiums, about your health plan, about your health savings account, how much you can communicate to each other on the social media, folks. Again, I place this place for mom, the button for seniors, independent senior living communities, assisted living communities, skilled nursing communities where they can get some help. I'm trying to set up hubs. Ultimately, if my dream gets fulfilled, you will have a hub. Hub is a place where you can receive your emergency, so-called emergent care. It's like a urgent care, robotic surgery center, independent living, assisted living, skilled nursing, you name it, folks. They'll be all under the one umbrella. So we will see. Right now, Foremost organization is a non-profit organization, as you could see. If you want to read about the concepts of personalized healthcare, there is a unlocking the secrets of health insurance premium. The credit goes to my friend Ron Bachman from Texas. You should read the books. Everybody should read these books. How to unlock the secrets of lowering health insurance premiums. So if you go to this, there is a book attached to it of the healthcare premium. I want everyone to read it, folks. And this is a non-profit. So we are not trying to uh, you know skim anything from the um, especially for the people who need the most. And we are seeking funds. We are trying to grow. We are seeking funds to trying to raise funds. So as a consumer's doctor, I feel there is a lot of avenues I can spread the word. I've developed some type of a uh, YouTube clips. All these things are linked to the Place for Dad, Invest in Americans, Medicare Choice Plus. You can go to each website, each YouTube clip, and look at the interesting videos. I'll be posting a lot more videos on healthcare revolution, the technology empowering the consumers. Medicaid card is useless. I would rather have if a person goes on a mandatory minimum wage, and they should receive the payments directly so they can put money aside into their health insurance, and at the same time put money aside into the health. They can save money and put aside the health. There are a lot of healthcare gadgets, and there are healthy trends, folks. And you can send us an email, and I will try to. Right now, we don't have a big staff, but I will try to address everybody's concern. If you, as long as you send an email, if they need to have a account set up, I already have collaborated with the health savings accounts. I can send you an application. There is an application on the website. It also will be an application for HTHP accounts where you can log in and create an HTHP account. And along with that, you also have a health savings accounts. Everything is on the website, folks. As I said, individual can contribute $300 a month. Family can contribute $600 a month, which goes a long way, folks. Which goes a long way. Employers, please call 855-695 1377. I will also provide the links on my description, and you can go to these different links, and there is also a chat. You can directly send me a message. You can chat on a right now it's on the bots. Ultimately, we have enough staff, we'll be able to cover, right? It's too early. And we are looking for a donation, folks, for the nonprofit organization. Through PayPal, it goes directly to the foremost organizations. And the only way we can survive is through your contribution, folks. Without contributions, we'll have but my message is still unyielding. I'll continue to put all my effort towards economically, physically impaired, especially people on the street. They need health insurance, which is affordable, and we need to take care of them. It's our social responsibility, folks. I believe we should be able to take care of, especially the people who are uninsured. Small employers. This is an ideal slide. I'm begging you to come to this landing page, talk to me. I will be able to help you in lowering your healthcare, your employees' healthcare costs. This is the site for the employers to come in. I will set up your employees' health insurance premiums. It can be lowered. We all work together. Yes, we all have. Again, and when you go to the bottom of the page, you have different pages. You can healthcare revolution. You will have Medicare Choice Best, different segments, consumers healthcare, healthy trends, Medicaid savings card, place for dad, and this is an ideal thing. And also empowering the consumer is the goal, folks. Empowering the consumer through technology. Yes, through technology. I've given a brief overview of what I'm talking about. Please read it and communicate. I would love to hear from you guys. If you do like this channel, subscribe to Consumers Doctors channel. And if you go to consumersdoctors.com, you'll get to this landing page, folks. You can still keep in touch with me. Make some comments. I would love to review your comments. And we will see you in the next episode. Again, thanks. We will see you in the next clip, and God bless. Goodbye.